I'm going to explain how dehydration before getting a blood test can invalidate the results, make you look anemic and sick when you're really not. And what you can do about it as well. Let's go through the presentation, screening for dehydration, what it practically means, what blood marker correlations you should be on the lookout as well to be able to test in your clients and patients whether they are dehydrated and what you should do about it, and how much water you should drink pre. This is for my Trinity students as a component of the blood work analysis course that is built for them. If you want to know more, the link is in the bio. First, let's talk about what is actually happening when you are dehydrated from a blood test. So number one, what we know is that dehydration decreases blood volume. And all blood volume is, as I fix up that typo, is the total amount of fluid circulating through your arteries, through your capillaries, through your veins, through the chambers of the heart. When you're dehydrated, your blood becomes more concentrated. And the analogy can be a liken to tea or coffee, which I'll explain in a second. Dehydrated, more concentrated blood can result in a falsely elevated hemoglobin and hematocrit. And proper hydration ensures your blood is appropriately diluted, providing an accurate reflection of your health. And so when I talk about the analogy of tea, I'm talking about, imagine, normal blood, hydrated in a euhydrated state. You add the right balance of tea to water. Tea isn't too strong, it's not too diluted, it's just right. And this would be represented in a normal hematocrit, as you can see in the far left diagram of the blood test, where the hematocrit's 45%. A dehydrated sample on the far right, let's say you forget to add enough water. So the glass is mostly concentrated tea. Tea flavor is really strong. And that you can think of a liken to elevated hematocrit. And so before I tell you how much water to drink pre, I need to explain what is actually happening in this diagram. When your blood is drawn and it's centrifuged and spun around, there is a typical presentation of the proportion of red blood cells that should be perceived or measured in the blood vial. And there's a range for it. You'll see it on your blood test range, and then we have optimal ranges. And the normal, you can see somewhere around 0.4, 0.45, or represented as a percentage here. And hematocrit is the proportion of red blood cells measured relative to the rest of the blood. So we can see here, and what's in those components is something else we'll talk about. What's in the red blood cells, what's in the erythrocytes is what we're going to talk about in other presentations. And we've actually talked about it a little bit already. So the hematocrit in the normal is expressed as 45%. The hematocrit in the dehydrated state is expressed as 70%. Can you have a think now about what the practical implications of that would be? About how it may skew certain markers. How it may skew maybe our red cell count, maybe our hemoglobin count. And then what implications we may see from that. Think about it. Because I'm going to reveal the answer shortly. So the practical is to drink 1 to 1.5 liters of water before your blood test. This is going to put you in a euhydrated state. You might even be a little bit extra overhydrated to an extent where you're peeing somewhat clear. I haven't seen evidence of overhydration to skewing blood test results, but it's very unlikely you're going to overhydrate yourself too much from 1 to 1.5 liters within an hour of waking. So people typically will get their blood test in the morning, and people are typically the most dehydrated in the morning after they haven't drunk for 8, 9, 10 hours properly. So this is why dehydration is more common with a blood draw that's done in the morning, because we typically want to do it in the morning because we typically do our blood draws in a fasted state, away from training. And so that's why this environment that we get the blood test in is often conducive to dehydration, and why upon waking you want to instruct the client patient to drink enough water. It's also going to make it easier for them to draw the blood, or actually find the vein and puncture the vein effectively in the most comfortable way. So now I'm going to explain. I've already explained hematocrit is the proportion of red blood cells in your blood measured as a percentage. Now let's explain what's actually happening here. Do you see how the erythrocyte levels in the red on the far left and the far right, they're the same? And isn't that curious? Because the only thing we've changed is dehydration. And how it's the same is because we know that blood plasma, is predominantly made of water. A very meaningful amount of it is made of water. So in a dehydrated state, that plasma can appear smaller because you have less available water compared to the norm, compared to what a hydrated state looks like. So if that's the case, then there's less relative plasma to measure, which makes the erythrocytes, which makes the red blood cells, which makes what's in the red appear proportionally, relatively higher. Does that make sense? It looks higher because there's less volume proportionally to measure within. As you can see, 70 expresses a percentage, which is very high. This is kind of an abnormal kind of example here. On the left, 45. Since the plasma levels on the dehydrated sample is low, it gives a falsely high hematocrit level. Why this matters is because you can get false erythrocytosis prognosis. Fancy words here. Prognosis meaning, we're establishing a cause, we're establishing a almost like a diagnosis of a particular condition. A likely cause of a disease or condition. And erythrocytosis, seeing a high concentration of red blood cells, which can have many causes to it, one being dehydration. But if we see an abnormally high amounts of erythrocytes or of red blood cells, and we don't know, and the clinician doesn't know it can be because of dehydration, you may make decisions and treatments and for the patient that are improper, inaccurate, unreliable, just ineffective, because you are shooting at the wrong target. There's another practical implication for this, and it can actually mask anemia. Now, on the left, on the second to the left, and the anemia vial here, what we see is the opposite. We see a low expression of erythrocytes, low red blood cells, low hemoglobin. The person is struggling with oxygen delivery and through the vasculature, uptake through the tissues, so we can see energy and fatigue problems there. Okay. So, but that's characterized as a low erythrocyte, so a low hematocrit, as an example. All right. But if we're dehydrated, then what happens is hematocrit jacks up. Okay. So imagine you're dehydrated on the right here, but you're not anemic. You're not anemic. So it just looks like hematocrit's really high. So it looks like erythrocytosis. Okay. Now let's imagine you have anemia, low expression of red blood cells, low hemoglobin. Okay. You have anemia and you have a dehydrated state. What's the presentation going to look like? I couldn't find a diagram to show this, so I'm going to have to explain it. The presentation is your hematocrit could look normal because the dehydrated hematocrit in the presence of no anemia is going to be high. Okay. Anemia is going to look low in the presence of hydration. Okay, so are we following so far? Dehydrated and anemic, where do we go? The middle. And that's why I've kind of drawn this line across, and you can see kind of where you can, and the line across in the middle of the polycythemia vial, trying to depict how it can be seen through the middle. There you go. I've added a little bit of a pink line to show you how it might sit somewhere between the middle. It's probably a little bit too high, but hopefully you understand my point and how dehydration can mask anemia. And that's why if a client has come in and done a blood test and they're experiencing all these symptoms and like, how much water did you drink? Oh, I can't remember. A bottle of water, like a couple of cups, maybe 1 or 2 cups. You can't necessarily make it. It's hazardous. You have to draw great caution in drawing an accurate, confident prognosis of whether their energy fatigue, their symptoms, is as a result of anemia or not. Now, of course, these aren't the only blood tests we look at. We look at iron panel in conjunction with the hematology and a mineral and a vitamin panel to put a picture together about whether anemia is likely present. But if you have one or a few markers that are pulling you in one direction, it gives you less confidence to make that assertion and thus address it with an appropriate protocol or guide. So I go slow down. I repeat myself because I think I know a lot of medical practitioners and, health professionals, they go really fast or they don't explain things in a way that are actually not dumbed down, but at the level of comprehension that is lay, that you could communicate to your clients. And so that's really what I'm trying to do here. So I'm hoping that's helping in getting that across. And if you guys have questions, just let me know, of course. So now we can see how it can mask anemia. Now we can see how it can create a polycythemia state, which is this elevated hematocrit state. You can see how dehydration can look like polycythemia. You can see how dehydration and anemia can make it look like in the middle, masking anemia. And then I've given you a little diagram here that I found. I love these diagrams and I find really helpful just to hammer home the point about what's happening here and how when we see the causes of polycythemia, hemoconcentrations, dehydration, low oxygen, congenital heart disease, pulmonary disorders, bone marrow stimulation, etc., etc. So you're telling me polycythemia has all of these expressions, all of these, I should say, condition associations, and they can also be partly masked or represented or triggered by dehydration. So you have to rule out dehydration. And the same with anemia. Anemia has all of these different presentations or causes, etiologies. And so keep in mind what's at stake here if you don't appropriately hydrate before a blood test. Or get your clients to. Lastly, just a little practical here. This is what we can expect to look at. Obviously, you can see, things are... This is not representing a dehydrated state. too many blood tests to go through for me to try and find one. It's not too common that I see it because I really emphasize to my patient clients to make sure they are hydrated. But just to give you an example of what you would look out for, you would look out for hematocrit, you would look out for red blood cells. These would be quite abnormally elevated in the presence of dehydration. Now, this diagram helps explain. I'm going to show you the blood correlations to finish off of dehydration because it's not just hematocrit. There's some other ones you can put the pieces together. But before I do, I just want to show you a diagram of, look, the plasma, as you can see, 55% plasma, the percentage of the volume. So you can kind of see what I'm saying now before about the volume and how if you have less blood plasma, then it's going to make the formed elements in the erythrocytes look so much bigger proportionally in the vial because look at how much water's in it. You can see 91%, approximately 91%. Like the majority of that plasma by weight is water. And so we can suggest that, okay, if dehydration's happening, then that water content's going to be lower. It's going to make the solutes and proteins within it look bigger proportionally. So albumins, globulins, fibrinogen, ions, nutrients, gases, and then that jacks up the RBCs or the erythrocytes. And I'm going to show you what's in that plasma that you can look out for. So we know hematocrit and hemoglobin. If that's elevated, that's a sign. But we know also total protein. Total protein being high, a marker for dehydration. Total protein being quite low, a marker for some type of stomach digestive insufficiency, potentially. Elevated liver enzymes like albumin and globulin, which makes sense because they're going to be presented proportionally higher given there's less plasma. Elevated sodium, potassium, they are represented in the solute section. And so that summarizes the blood correlation you need to look out for if you're dehydrated. The biggest practical takeaway is consume 1 to 1.5 liters before your blood test draw. And pass this on to your clients and patients so they can understand why they need to be hydrated. And pass this on to other health professionals and clinicians who maybe don't understand the importance of hydration before a blood test draw. Now you do, and if you want to see the full blood test course, you can message me and let me know. Otherwise, for my Trinity students, obviously you get all of it. Any questions, put it in the Discord or message me.